Hey folks, Dr. Joe Esposito here. I am glad you're with us now. What we're going to talk about today is how different health conditions affect men and women differently. And this is important, and we call it in my business a differential diagnosis. So if a man comes in and he feels like an elephant is standing on his chest and he's got shooting pain down his left arm, what do we call that? Heart attack, right? So we have to immediately address that from a medical standpoint. We get somebody to emergency room immediately if we have that coming in. If we need to, with a heart attack, as long as the heart's beating, you don't do CPR. If the heart stops beating, then you start doing CPR. And when I learned CPR, was it 6 compressions to 2 breaths? I don't even remember what it was. But now we realize that you have oxygen in your lungs. It's more important to get the heart beating. So now it's mainly compressions to the chest with very little breathing. And you do the compression to the chest to the Bee Gees song "Staying Alive." Ba, 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 ba. And so that's the rate that you want to do the compressions on the chest. Now, I remember when I was taking CPR way back, I was probably 10 years old, 11 years old, and somebody said, you can break a rib if you do this. And then somebody said, well, why would you want to do this if you're going to break a rib? They said, well, it's easier to fix a broken rib than somebody dying. And I thought, that's a good point. So men and women, starting with heart attacks, have different signs. So the telltale sign for men, again, elephant on the chest, shooting down the arm. For women, that's not the traditional sign for a heart attack. Many women feel upper back pressure, jaw pain, and they're short of breath. Or they may feel nauseated or dizziness instead. That can be a sign of a heart attack. Heart disease is the leading cause of death for both genders in the United States. Women are more likely to die after they have a heart attack than a man. So if you start having these symptoms, it's something you don't want to take lightly. Go get it checked. I love when I do tests on a patient and they come back negative. And it's kind of funny. It reminds me of my mom. And we had our family doctor was Dr. Waltman. And we were in Hoboken, New Jersey at the time. And we'd walk around the corner to Dr. Waltman's office. I remember he had big glass blocks at his front door. And now they're cool again. Back then they were fashionable. Then they went out of style. And you could see the light come in. And I remember sitting in Dr. Waltman's office. And I was less than 9 years old. And he'd always give me a needle. He'd always give me an antibiotic for whatever it was. Because at the time, antibiotics solved everything. We realize now that they can actually cause more problems sometimes than they fix. But no matter what you had, he gave you a shot in the butt. And I just remember pulling my pants down and getting that shot in the butt. And it hurt like terrible. But I remember one time going there. And Dr. Waltman said, well, he's fine. He just has a cold, whatever, and just send him home. And my mother was mad. She says, I can't believe, I think it was $5 for an office visit at the time. I can't believe we spent $5 or $10, whatever it was, and he wouldn't even give you a prescription. So the mindset was we wasted our money because he didn't give us a prescription. How silly is that? How great is that? We didn't get a prescription. But the differential diagnosis that he did, and that's the first time I didn't know what the word meant, of course, was that he said, we don't really need to do anything at this time. We did some tests were negative, go home. So if a patient comes in and we do a hair analysis on them, or we do a food allergy test on them, or we do chiropractic evaluations on them, and we say, you know what, there's nothing here that fits, that really needs care, let's just give it some time to wait. I love when that happens. So if you're having chest pain, women, dizziness, pain in the jaw, upper back pain, and again, upper back pain can be caused by other things too. Jaw pain can be caused by other things. There's a lot of things that can cause these symptoms. But if you have them and they persist and you start getting sweaty and dizziness and anxious, it might be something you want to consider getting checked. And I hope your tests come back negative. And I want you to say that was money very well spent. Let's talk about COVID-19 for a second. Men are more likely than women to have serious cases of COVID-19, and it's not clear why. And we men are more likely to have the long COVID, symptoms that last for a long time. It could be because men many times have other health problems like diabetes and obesity, but not everybody. Even healthy men, if they come down with the disease, can have an issue. But another reason might be that women tend to have stronger immune systems than men. And that may be due to estrogen, actually. But women tend to have a stronger immune system than men, so men may be more likely to have problems. And then, of course, as we get older, obesity, there's other things involved as well. So there's one for the women. We'll put that in a women's column there. Multiple sclerosis. I wish that doctors would understand the neurological impact that food has on multiple sclerosis. Because I've had tons of MS patients over the years come to me, and The doctor said you just have MS. Don't worry about it. We'll give you some drugs. It's progressive. It's probably going to be progressive. There's not much you can do about it. And yet then we find out that if they're doing dairy products flares up multiple sclerosis. Artificial sweetener, aspartame. Aspartame has symptom for symptom, identical symptoms as MS. And so the only difference with MS is when you do a brain scan, you'll see little white focal spots in the brain. And with aspartame toxicity, you won't. But I've had many, many patients come into my office, and I've gotten them off aspartame. Their headaches got better, their nervousness got better, their anxiety, their sleep, their love life, everything changes when you get people off the artificial sweetener. So of the 7 deadly sins, alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener, the worst one that you can eat is artificial sweetener. So I'm on my knees begging you, please, folks, give up the artificial sweetener. That's aspartame, sucralose, saccharin, any of the artificial sweeteners. Now, people say, well, what about stevia? Stevia is not an artificial sweetener. Lohan, not an artificial sweetener. Xylitol, not an artificial sweetener. So those are better choices. But sucralose, Splenda, and saccharin, I'm begging you, please, folks, I don't know how else to stress the importance of this statement. You need to get off them right away. But MS and dairy products, no one even thinks about MS and dairy products, but if you have MS, I strongly advise you never, ever, under any circumstances, eat a dairy product again because it's so toxic. Men seem to have progressive MS more so than women. Women usually get the early stages, but the progressive men get it worse, and they kind of catch up to the women. So MS, nervous system, artificial sweetener, chiropractic care, several things you can do to deal with it if you have it. Other issues like stroke. 55,000 more women than men have strokes each year in the United States. That's a lot of people. Common symptoms are sudden weakness on one side, loss of speech and balance, and confusion. I've had people have strokes, so you may have been around somebody that has it. The way a stroke works is like this. The right side of your brain controls the left side of your body. The left side of the brain controls the right side of the body. So if I start drooping on my left side of my face, if I have trouble speaking, spit starts running down the left side of my face, I can't move my left arm, what side of the brain is the damage on? The right side. Now, when I went to school, way back when, we were taught that once brain cells were dead, they were dead forever. But I remember thinking, when I was in college, why is it that stroke patients then sometimes recover? We have patients come in all the time. I had a stroke 10 years ago, and you see nothing different about them. Because the brain has a capability or a quality called plasticity. Plasticity is plastic. So the brain can remold itself and remodel itself and rewire around damaged areas. So if I have a certain part of my brain that's damaged, the brain can rewire around it. And so if there's damage to the right side of the brain, I have to use the left side of the body more to send neurological impulses up there to stimulate the brain. The brain needs 3 things. It needs stimulation, it needs oxygen, and it needs nutrition. And if it's not getting all 3 of those things, it's not going to work the best it possibly can. So we can do a very simple test on patients, especially patients that are like dizzy. And what we'll do is we'll have them stand up, I'll put my arms around them, and I'll see if they start to fall to one side. And if they fall to one side, it's called a Romberg test. Many times there's an issue in the cerebellum. That's the back part of the brain. So we can stimulate just one side of the body to stimulate the cerebellum and try to reboot the cerebellum. If it's not a falling issue, if it's a control issue, then it's the cerebrum, and then we have other things we can do. So there are techniques, it's called functional neurology, where we can actually start to reboot the brain. So it's kind of cool that when people are told, well, there's nothing you can do about it, in reality, there's a lot of things you can do about it. And that's kind of fun. And that's part of the chiropractic evaluation that we do on our patients, because we want to get the nervous system working, the digestive system working, and the diet right. So we can do certain things to stimulate certain parts of the brain. And when we can do that, it's kind of neat. There's also something called brain mapping. Whatever it is. You can have somebody just follow your finger and think about something that's bothering them. Let's assume they had an abusive childhood or they had an emotional trauma. And you just have them follow your finger. And when it gets to a certain point, they say, oh my gosh, I feel more anxious about it. okay, let's have you focus on this and then let's talk you through it. So it's something physical that therapists can use to help get the brain to reboot itself. We're all victims of our past. We're all victims of our childhood, of past relationships, of people that we knew. I know there's a guy named John Ranke who in third grade, he used to threaten to beat me up. Never did. And I still remember that the fear that this kid instilled in me. He's dead now, which I won. But I still remember the fear that he instilled in me. He never touched me once. He just threatened to hit me. And so that's an issue in my brain that I had to work through. So you have to look at things, and there's actual physical things that we can do to get the brain working more efficiently. It's kind of neat stuff. And that's why I think our offices are I'm not going to say better, but different. And I feel, in my opinion, my doctors are some of the best doctors in the world because they're my doctors. And so when we have issues, we have 6 of us, and we all sit down and we discuss the case. All right, we got Mary's case. What do we do for this? Well, have you done some neurological work? Yeah. Have you done chiropractic? Have you done nutrition? I get questions all the time from patients. Patients coming to me and for some reason, folks, if you come in as a patient, trust me, all my doctors are brilliant. You don't have to ask me every question. Had somebody call the other day and he says, I'm going to have surgery. What should I do? Well, did you ask the doctors treating you? Well, I want to talk to you. I'm gladly talk to you. But trust me, my doctors are really good at what they do. And again, I'm more than happy to talk to you. So we do a very thorough evaluation on a nervous system, digestive system, diet, making sure you acid reflux, heartburn, that we can fix anything physically. And then we try to work on it chemically as well. And that's what kind of gets me excited about working every day. After 37 years, I still get excited about it. So anyway, I digress. So we were talking about strokes. So loss of speech and balance, confusion. With women, often they have additional or different symptoms: fainting, agitation, hallucinations, vomiting, pain, hiccups, seizures. These can all be signs of stroke, more common in women than in men. Men are the classic signs. Facial issues, loss of control on one side, they fall to one side. Women have all these other issues. And women, by the way, are less likely to recover from a stroke than a man, and that's why we have to do that extra work. Another thing we can do with brain injuries, whether it's traumatic brain injury, stroke, Alzheimer's, Parkinson's, I recommend hyperbaric chamber. Now, hyperbaric chamber is really cool. We don't have them in our office. I go personally to a place called Medici. The chambers are in Kennesaw, Georgia, and it's really neat. They put you in a chamber, and it's clear plastic. You get to watch TV. It's fine, and it's super high concentrated oxygen under pressure. And it drives oxygen into the body and helps heal wounds, fractures. But many times with traumatic brain injury, it super oxygenates the brain. And then hopefully the brain can rewire itself. So it's not everything that we do. It's not anything we do, but we work with other people that do. So again, I may not know what to do, but I know the guy who does. And that's why it's good to know people like us. So we're talking today about different ways, different conditions affect men and women. Now, when it comes to pain, women seem to have a higher pain tolerance than men. So when men come in screaming in pain, we always want to say, okay, what's the cause of the pain? Sometimes women will come in and say, well, it's just a little stiffness or a little tightness. It's no big deal. It is a big deal. Pain is a warning sign. Pain is telling you there's something wrong. And so if you have pain, our doctors want to get to the cause of the pain, not just treat the symptoms. The most common, by far, most common cause of pain is a pinched nerve. So if you have neck pain, back pain, shoulder pain, numbness, tingling, headache, sciatica, muscle weakness, chances are it's a pinched nerve in the spine. My doctors are really good at diagnosing that, and they're really good at working on getting it corrected. So if you'd like to make an appointment to come see us in the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. We would love to be your doctors. Dr. Joe, drjoe.com. You can book it right online. You can call us. You can send us a message. Many people say, I'd like to make an appointment, and I just say, call us or do it online. If you want to send a message, Joe and I are happy to answer your questions for you, but it just saves you a little time. You can book an appointment right online. The initial visit, normally $720. That's an exam, x-rays, consultation, first treatment, going over all the findings with you, and a complete nutrition evaluation. We've reduced that to $299. I can't imagine why you haven't made an appointment yet. And if you haven't, do it right now. You can do it right at drjoe.com. And we accept most insurances. Probably 40-50% of our patients don't have insurance, or if you have deductibles that are insane, you don't have insurance anyway. Let's call it what it is. I'm not a fan of insurance companies. We accept it, we work with them, but I'm not a fan of them. So if you'd like to make an appointment, drjoe.com. You can book it right away. Do it soon. Don't waste your time. Every day that goes by, your condition is probably getting worse. And from my experience, if you're ever in a car accident, if the car was damaged, you were damaged. That's my experience. I've never seen it any other way in 37 years. So get to us right away. The longer you wait, the more problems it's going to be for your health and also many times with the insurance company. So drjoe.com, I expect all of you to make an appointment right now because you're just sick and tired of being sick and tired. And many patients say, why didn't I do this sooner? I don't know. Just come see us. So we're talking today about how different problems affect men and women differently. How about sexually transmitted diseases? Women are less likely to have symptoms with sexually transmitted diseases like chlamydia and gonorrhea than men are. So women can be a carrier, and that becomes an issue. STDs can also lead to chronic pelvic inflammatory disease in women, and that can cause some really serious issues, including fertility issues. Gonorrhea can get into the brain and can cause madness, can actually kill you. It's called tertiary. Syphilis, I'm sorry. Syphilis can get into the brain and cause brain shutdown, craziness, insanity. So it's not something you want to take lightly. Men seldom have these complications. They'll have the outward symptoms, but they wouldn't get pelvic inflammatory diseases and things like that. HPV, human papillomavirus, is the main cause of, with women, is a big issue. With men, we're mostly the carriers. We don't seem to have symptoms. It doesn't seem to affect us nearly as much as women, and many times it's asymptomatic. And so it's a good idea to get tested periodically if you're active, because you don't know. You may be totally innocent. You may have had one partner in your whole life, and you can have problems with it. Your partner may have had one partner your whole life, and they can bring it over to you. So it's not a bad idea to get tested. You can go to, there's lots of places you can go and get tested. You can even do mail-in tests now. You could use a phony name if you want to. You're not supposed to, by the way. Don't say I told you to do that. And get those results. But it's really important to find it out, not just because you don't want to spread it, but because it can have an adverse effect on your health as well. And again, women are affected different than men. Hair loss, I hear about this a lot. Women, of course, generally, they just lose hair everywhere. For men, we usually use hair on the top, but we don't lose it on the sides. And the reason is there's a hormone that affects the hair on the top of our head more so than on the sides. So that's why if you do a hair transplant, for example, you can transplant hair from the side of your head to the top of your head, and it will never fall out again. It's not going to be affected by the hormones. You can take hair from any part of the body and put it anywhere, actually, with these hair transplants now. But that men and women are affected differently. So there are certain things that we can do about that, of course, is make sure you have a good diet. Laser treatment. We have a laser that we use, and laser treatment can stimulate hair growth. Now, it's not going to give you this big afro, but you can actually do laser treatments to help stimulate hair growth. That seems to work a little bit. But men and women, again, are affected differently. That's what we're talking about. Acne. I mean, if you're going through puberty, you probably had acne at some point in your life. Women usually worse than men because of the hormone cycles. And their cycles go, are much more dramatic than with men. And so women may have more acne. But in most cases with acne, diet has a direct impact on it. Now, I remember years ago when I went to school, we were taught that diet has nothing to do with acne. Chocolate has nothing to do with acne. Sugar has nothing to do with acne. Well, that was wrong. And I remember thinking, I know I learned this and I have to study it for the test, but I know personally, other people knew personally, if they ate chocolate, they had a breakout. So it's kind of silly. So food has a direct impact on every single aspect of our lives. And I wish we put more emphasis on food and not so much on how quick can we get it, how cheap can we get it. Cheap food is very expensive. Because if you have heart disease and diabetes and cancer and shortens your life and lowers your productivity and ruins your relationships, it's very expensive to have those cheap hamburgers every day. It's way less expensive to eat well. Like if you have a salad and soup, let's say. You can get a big one of those plastic clamshells of organic salad. I think I got it at Aldi for $4.30 or something like that. I can easily make 5 salads out of that. So if that's less than $1 a salad, and then if I make soup, if I make, split pea soup, lentil soup, bean soups, vegetable soups, usually less than $1 a serving. That is, I don't know, a little bit of work involved, not much. And for $2, $3, I can have an amazing meal. Let's say $5. Let's get crazy, okay? So for $5, I'm going to have an amazing meal. And with inflation being what it is, and with prices going up, and with the quality of food going down, I don't know why you wouldn't prepare your meals. Like I do it on Sundays, usually Saturday or Sunday if I have time, or someday during the week, I just make a bunch of, like a big bowl of soup, a big pot of soup. You can get a pressure cooker, and you can make split pea soup. It takes about 12 minutes to prepare. I timed it one day. Put the pressure cooker on. It takes about 45 minutes to cook, and you're done. And you literally have a meal every day of the week. And it costs probably about 50 cents a meal. Organic, everything organic. Carrots, celery, onions. You can use vegan bouillon cubes if you want to, or just a little bit of salt and water and some split peas. Put it in the food processor, put it in a crock pot, and you're done. So if you don't know what to eat, on my website, drjoe.com, we have a book, and my first book I ever wrote, actually, I've written two, is called Eating Right for the Health of It. And it has recipes and menus, and so it's all there. Very simple, very easy, unbelievably delicious food. We have an ebook, too. I think Joe could even send you an ebook if you need it. So that's available. If you don't know what to eat more generally than that, go to our website, drjoe.com, and type in, "So what can I eat?" and listen to a whole hour that we did on breakfast, lunches, dinners, snacks. It's all there. So feel free. And our podcasts, by the way, are free. We have over 2,000 hours on our website, drjoe.com. We have audio and video. So you can type in what you're looking for: heart disease, diabetes, cancer, weight loss, pain, women's issues, men's issues, whatever it is. Chances are we've done a podcast on it, and we have video there too. So some people are visual learners, some people are auditory learners. I want to stimulate your brain the best way that we can. I do recommend you listen to them more than once if it's a topic you want to learn about, because I talk fast. I throw a lot of technical terms out there, and your brain just can't focus for a half hour, 20 minutes, whatever it is, or an hour. So you could listen to them over and over again. It's no charge. If you're a podcast junkie and you like your podcast services, just type in Dr. Joe for the health of it. Dr. Joe for the health of it, and you could listen to us on your podcast services. We do live podcasts. We do a live podcast usually on Tuesdays. So you can tune into our live podcast and see my pretty face. And you can do that by following us on social media. My handle is @Dr. Joe Esposito. And we're on Facebook, Instagram, YouTube, and Twitter. And whenever we do a live podcast or a remote, we're going to post it, and you can tune in and watch it. We post health tips almost every day. Sometimes it's a recipe. Sometimes it's a health tip. Sometimes it's an exercise. Sometimes it's how does an adjustment work? So @Dr. Joe Esposito, I need you to do that, by the way, because we're only, I think we're 2,500 people, less than 2,500 people away from 10,000 on Instagram especially. So @Dr. Joe Esposito, please do that. We do, like I said, we do COVID testing at our offices now. If you'd like to do that, of course, there's no charge. We'd be happy to get that done for you. And the initial visit, normally $720, we've reduced it to $299. So there's no reason why you shouldn't be making an appointment right now for you, your friends, your family, and your children. If children start out healthy, chances are they're going to have a much healthier life. And remember, your kid's going to have to take care of you someday. You want to make sure they're healthy. So feel free to do that. If you have any questions, send them to it through the website, drjoe.com, and a little bot pops up. Type in your question. Joe or I, my partner, my assistant, is more than happy to go ahead and answer your questions for you. And I'm amazed how many questions we get at 2, 3 o'clock in the morning. I wake up in the morning, I see there's 5, 6, 10 questions sometimes. It's like, wow, everybody's up late at night listening to the website, drjoe.com. So we really want to be your doctors. We want to do everything we can to help get you well and keep you well. And yes, we accept insurances, Medicare, Ambetter, car accidents, sports injuries. We take almost every insurance as well. And again, just do it. Stop wasting time. You're suffering needlessly in most cases, and I don't want you doing that. So other things, we're talking today, a few more seconds, that affect women differently than men. And we talked about pain. And chiropractic care, again, most effective, least expensive treatment for pain. Whether it's a little pain or a lot of pain, chances are there's something causing it. And my doctors always want to get to the cause of the problem, not just treat the symptoms. Folks, I'm almost out of time. More information at our website, drjoe.com. Follow us on social media @Dr. Joe Esposito. Tell your friends about the show.